When I was 45 years of age, I actually ran the Scotiabank Toronto Marathon. And a year later, while I was teaching my fitness class here at the studio, I had a heart attack. I had severe chest pain that was excruciating, and I continued teaching my entire class. I just reduced the weights that I was using, and I kept teaching because I was thinking to myself that I'm feeling this pain, but it could just be muscular and just keep going.
In 2008, I was 44 years old with no previous heart problems and was on vacation with my wife in Mexico. So one morning I tried to go jogging, as I usually do, and I just couldn't do it. I felt pressure in my chest. And from that moment, I knew there was something very wrong.
I had no idea that anything was really wrong, and I kept continuing on over the course of the day, training my clients and then taking my daughter to the soccer field. And at the end of the day, at the soccer field, I actually met my neighbor there, whose mother was a nurse, and I explained to her the severe chest pain that I was experiencing all day. And she said to me that I needed to get to the hospital.
A few days after I got back to Toronto, I was diagnosed with a viral cardiomyopathy that caused congestive heart failure, arrhythmia, and my heart function was so low that doctors were talking about a heart transplant. I was confused, in disbelief. I spent 25 days at Sunnybrook, and after many tests and procedures, a defibrillator was implanted in my chest. They gave me medications, and I was sent home with a 33% chance of recovery.
On a canoe trip in the Northwest Territories, and I was with 3 other women, and we were paddling along, and I started to feel what I thought was acid reflux, some indigestion, and it got worse over the course of the afternoon of paddling. And eventually I was extremely uncomfortable. I decided once we got to our campsite, I set up the tent, I got into bed, I couldn't lie down, it didn't get better. And fortunately for me, one of the 4 women on the trip was a doctor. And so I eventually asked her to come over, and she came over and took my pulse and said, I wasn't expecting this, but your pulse is irregular, and I think this is a medical emergency and we should have you evacuated.
The presentation of heart disease, like a heart attack, can actually be quite similar between men and women. We'll start with that. And then there are some important differences. The classic description of a heart attack might be this crushing retrosternal chest pain. Middle of chest goes down the arm into the neck, associated with shortness of breath, nausea, sweating. And many men and women may experience all of these symptoms together.
I didn't even know I was going to have a cardiac event, to be honest. I'm diabetic, and after I finished working, I used to go for a walk every day. If I walked slow, nothing happened, but if I walked fast, I had an acid reflux. One of my good friend who was concerned, and she said to me, she said, I think you should get it checked up. I didn't even know I had a problem till I went to the doctor. And straight from there, from the cardiology, I was sent to the Sunnybrook. I didn't even come home. I didn't even know that my arteries were blocked.
The work primarily I focus on is working with both men and women, but right now my focus is more so on women and examining ways to help facilitate their transitions from hospital to home and into cardiac rehab. And some of the work I do focuses on interventions such as peer support, providing support to patients through other patients who have the lived experience of support, as well as through technology. We've developed an app for patients who are leaving hospital after cardiac surgery, And this app really focuses on helping to answer their questions around recovery and facilitate education as well as early entry into cardiac rehab. We know that less than 30% of the population who have a cardiac or heart condition or procedure actually access cardiac rehab. So we're really focused on facilitating that progression and making it more accessible to both men and women.
I had what is now known, what I have now learned is called unstable angina. So what in January 2004 I had some weird feelings at night after a wonderful day of cross-country skiing. We were watching TV and I just had a sort of a strange fluttery feeling, which I knew wasn't normal, but it didn't hurt or I wasn't upset by it, but it wasn't right. That just passed. And I guess I had a few of those episodes through February. So I talked to my doctor and she said, well, maybe we should pursue it, but we didn't worry about it too much because I had no pain, I had no real strong symptoms. Early May, I had an angiogram and it showed a 90% blockage of my left anterior descending, and a week later I had bypass surgery.
First myocardial event, I had it in 2000. In 2000 I had problems because I needed to have 3 bypasses and a valve replaced. And took quite a few months of recovering home.
For my dad, as I said, when he had his first, he had a mild heart attack when he was 72, and he was well enough to advocate for himself. But you fast forward when he was 90 and he wasn't well and got rushed to emerge, they look at him and they go, you know, I think they're thinking in their mind, he's 90, what do you really expect? But they don't actually see him when he's well. So they don't know that he's active, he rides his bike every day, he works part-time, he looks after my mom, he volunteers for 2 charities, and he still contributes and wants to contribute. He still drives, he passes his driving test.
I'm still cooking a good meal too.
But it was at that time, in the late 70s, where I started to get very interested in heart disease and the impact of exercise. And that sort of led me to Dr. Terry Cavanaugh in the late 70s, where I started my volunteer work up at what was then called the Toronto Rehab Center. He broke the mold. He was not a conventional physician. I mean, he sent cardiac patients and successfully had a number of them complete the Boston Marathon, I think back in 1973. Some doctors thought he was showboating. Others thought, wow, now the world knows that the world's sickest track team, as they call themselves, can actually reach those states of physical activity that no one really thought before. So he pioneered exercise rehab in patients with heart transplantation. He was one of the first to study exercise in heart failure. So he really paved the ground for a number of different programs around the world.
For anyone that has just had a cardiac event, I would stress to them the importance of asking for help. Don't do this alone. There are people out there, doctors and cardiologists and physiotherapists. There's lots of different people, including the psychologists, the dietitians, and the nutritionists, all part of the cardiac rehab program, that are all there to help and help you overcome the fears of taking action and help you to move forward.
What I've learned going through this process is that life is short. So you gotta enjoy every minute. It's a total lifestyle change. If you try to do something for like a month or 2 and then go back to your old habits, it's not gonna work. You gotta keep on track, right? You gotta change your lifestyle, change your foods, change what you drink, change how you exercise, everything. Everything's gotta change, and then you'll have a chance to succeed, right? And live.
So if you've had a heart attack or heart failure or have just been through a surgery, get linked up into a rehab program in particular, where you're going to find all of these resources and professionals that will come together around you. If you're looking for some resources in the meanwhile, check out a few great places. like the Cardiac Health Foundation of Canada website, where there's some wonderful resources for patients and family, Heart and Stroke Foundation of Canada, and our own hospital has developed a series of great resources that are devoted to learning more about heart health, exercise, nutrition, psychosocial health, and the important part of trying to bring all this together and taking control of your own health. That's really the goal here, is that you've had an event, but you can recover and you can actually get stronger, fitter, better than you were ever before, just by following the program, taking these steps, and taking control of your own health.
I think a lot of times we think we can just look after it ourselves, and maybe sometimes we need to take the advice of others and really pay attention to our bodies more than we do, because it's important.
The rehabilitation process I found really helpful because there were two parts of it. And half of it was actually based on walking around the track, and walking around the track at the pace in which they prescribed. But the other part that I found really helpful was the lecture series. So that, I would say, those components made a big difference, and they also gave me a prescription for exercise every day. So I had something that I was focused on doing every day to improve my health and to accelerate my recovery.
I thought I was gonna die. You know, you don't know, right? And once I got out of there and I recovered, I was happy as hell, right? So I'm trying to enjoy my life as much as I can.
Then second thing comes, am I gonna survive? Am I gonna make through this? And then when you make it through, then you wanna survive, you wanna live. So there's a process in your mind that you have to make yourself stronger.
I think to sit around and worry about your condition isn't going to do you any bit of good. I think you got to get out and you got to be active, and I think the key is to integrate it into your lifestyle, and rather than finding time to squeeze in your exercise prescription, who would do that with their medication? You would take it religiously, and I think if we could package exercise into a pill, you'd take it every day. So I think the same attitude may be beneficial with physical activity.